Hi, I'm Jonathan DeMonte, and I'm going to show you a little video instruction on how to treat low back pain using Bowen therapy, a pain relieving method from Australia that's used widely because of its excellent ability to relieve pain quickly and efficiently. This video is part of a series of videos available at bowenonline.com, and you can enjoy it and share it with your friends, and let me know how you like it. Thank you. So I'm going to show now a quick overview of the Bowen therapy procedure for the sacrum. Here you'll see that we palpate along the spine over the sacrum and looking for a hollow just below the inferior margin of the sacrum. We use our thumb, push up, pull down, replace your thumb on a holding point just where you did the move and push the glute into the holding point. Let's look at the details now. So the sacrum procedure is one of the most fundamental procedures in Bowen therapy. It's easy, it's simple, it works. You should expect 90% of the people you perform it on to see a difference immediately. So it's very exciting to be able to do that. I mean, in terms of treating pain, this is a dream procedure. So that said, you're able to treat many chronic conditions as well, such as sciatica, sacral iliac pain, and these are people who may have been for endless therapy elsewhere, and you'll be able to address this very easily, very quickly. So the sacrum procedure relates to hip pain as well as low back pain, because the sacrum is often out of alignment due to its accommodation to another problem in the pelvic floor. So think of pregnancy as an ideal scenario for this procedure. So the procedure itself consists of two pairs of moves performed on each side. Move 1 is both a move and a holding point, and move 2 is a move similar to what we did with moves 3 and 4 of BRM3. It's a medial move pushing the Gluteus Maximus towards the holding point in the midline of the spine. So the landmarking for these procedures consists of palpating for the lower margin, the inferior margin of the sacrum at about 1.5 thumb widths away from the midline. So you can take your thumb tip and push along the spine until you reach the sacrum, palpate the bone of the sacrum until you reach a small hollow. It's there that we'll be able to find the other structures that we're going to be working on. So in this picture you can see clearly the alignment of the spine as it sits on top of the sacrum, and how the sacrum sits inside the arc of the pelvis like a point stone. So this is the structure we're going to be working on and allowing to move more freely. The sacral tuberous ligaments are really what hold the sacrum out of alignment. And when we do the move, you'll often feel one side a lot more tension, a lot more tense than the other. And so you get the sense that you are releasing this tension when you perform the move. But look at how the sacral tuberous ligaments link from the sacrum all the way to the front of the pelvis in their alignment, in the government of the alignment of the sacrum. So in this image you can see the sacral tuberous ligaments, the sciatic nerve, the piriformis muscle, and gluteus minimus. And so all of these muscles are very much in play when we do this procedure. In the next slide, we're going to see gluteus maximus and how it's manipulated during this procedure as well. This picture actually is a very useful one because it shows you the outline of the lateral margin of the gluteus maximus. And so you can see how we're moving the whole muscle towards the holding point when we perform move 2 of the sacral procedure. And so there's multiple factors going on, and essentially we're easing the foundation of the sacrum so that it can move into its ideal alignment within the arc of the pelvic structure. the sacrum can be tilted in every direction, and so it's a very, very important procedure to perform. And you'll observe every client when they stand up and walk around after this treatment session, how tight they are, how limber they are, how well their sacrum is moving. So sacrum, I'm going to just show the outline of a sacrum. Another way you can palpate it is along its border, like so, and see how big it is. And it goes along there and turns in here. And it's in this spot that we're going to perform a move. Following that, we're going to push the whole glute across, like so. So to find the sacrum, we can palpate along until we reach a hollow. So there's the sacrum, and here's the hollow. Our thumb goes in the hollow. In this position, we take skin slack up, challenge, and move inferiorly. Now we replace the thumb as a holding point now. Where we did moves 3 and 4, followed by 9 and 10, we would take slack and challenge and move the whole muscle to the side. So once again, standing at the side of the person you're working on, find the notch below the sacrum, just like this. When you find the hollow, sink your thumb into it, take skin up, and then pull down over the ligament. Replace your thumb, find the edge of the gluteus maximus, and move that edge towards the holding thumb. That's it.